LBC News Time, 7:05 this Thursday evening. Hello, welcome along to the programme. Let's get some more reaction now on Health Secretary Matt Hancock defending the government's decision to abandon developing its own contact tracing app. Dr. Scott McLaughlin is founding fellow of the Australasian Institute of Digital Health. Hello, very good evening to you, Doctor. So we've had, as Boris Johnson would put it, and we'll recall going up to the election campaign, dither and delay, and it seems that there's plenty more, not even that, a whole about turn.
Well, yeah, there seems to be a lot of confusion, though, in the way that the government have presented the idea of a contact tracing app. The first one being that, OK, they were developing their own app, and they're now presenting that because they're moving to the Google-Apple model, their proposed API system, that this somehow means that the government's not developing an app, which is not the case. They still need to produce an app or develop an app that will use the Google-Apple as a structure underneath, as an architecture. So they're still developing an app. They're still spending taxpayer dollars on yet another app with no guarantee that it's going to fare any better.
The reasoning is what? That it's looking towards Apple and Google because their own app doesn't seem to work.
Well, the reasoning for the change is that the Google-Apple API, an API or an application programming interface, is a way for the front-of-house application, what you see on the desktop of your device, to talk to the hardware underneath. Okay, so the reasoning is that because Google and Apple would not expose the hardware to developers without you using the Google-Apple model, that by changing from the NHS's own model to the Google-Apple model, they will somehow have better connectivity with the underlying hardware, the Bluetooth chip in your phone.
I mean, it does seem a mess, doesn't it, really?
Well, yeah, the fact that they couldn't seem to develop an app in the first place that was able to work on multiple phone models, you know, as in the Android phone or the iPhone, and that they couldn't even get it to work on phones that were older than sort of 18 months or 2 years, that already suggested that they didn't do their research properly before attempting to develop an app. And several other countries, to blame Apple, for example, today, several times the minister said that, well, it's all Apple's fault. We got it working on Android, but Apple wouldn't play ball. To blame Apple is disingenuous because other countries, including several states of America, have got software developed with the Apple devices working quite well.
Where do we go from here then? As I say, it does seem to be rather a mess, and this app that had been promised, no sign of the government's own one emerging at any time.
Well, that's the other thing, is the way that they're talking at the moment. It could be 6 months, it could be Christmas or later before we've got anything from them, by which point, well, already the horse has bolted. Shutting the gate at Christmas is probably not going to help us.
Yeah, that's exactly what I was getting at. This delay, how will it affect the government's aims to get on top of this thing?
I can't see, and our group has done a considerable amount of research over the last 3 months just on this issue of contact tracing. We can't see that the government's contact tracing app is even going to have any real effect on containing or managing COVID, leaving aside the fact that contact tracing historically has been used for low prevalence, low contagion diseases. It's not previously been shown to be effective with such a highly contagious, highly prevalent disease before.
So does that have effects then about the government's ability to deal with coronavirus and to bring cases down?
Well, firstly, the way that cases are going to come down is if we continue to be sensible about what we're doing. So if we continue to maintain our social distancing, if we continue to be sensible about where we go, whether or not we have large events just yet, and wait for the disease to die down. Now, many of the doctors that we work with, and other doctors overseas, epidemiologists, are telling us that there's likely to be a second or third phase of this virus at some point in the next 6 months. It would be good to have various forms of containment in place, including a reasonably proactive contact tracing model, especially for people who travel. Contact tracing apps with some management worked in countries like Israel, Taiwan, South Korea, so there's no reason that they can't work, but you've got to have it in the right place at the right time, be giving it to the right people, and making sure you've got the infrastructure behind it to back it up.
So does that mean we have to rely on Apple and Google now rather than what the government originally intended to do?
Well, no, because all Apple and Google are doing around the world is providing you with this application programming interface, this gateway, to be able to talk to their hardware. That's all they're providing. It's up to each of the individual countries who are developing contact tracing models to use that in an app that is developed for their local environment. So we still need to rely on somebody here in the UK to develop an app that is suitable for the UK and match that app up with the track and trace system in the hospitals, match that app up with other sources of information. And one of the ways that we in our group have suggested that this can be done is by giving instead of putting the app on a citizen's phone and relying on citizen having to rely on the app at some point in the future to possibly tell them they've already been exposed, give the citizen an app that actually can give them some sort of likelihood for whether or not they've already been exposed, even in the absence of accurate information about the other people that they've been around with.
So this is something tantamount to antibody tests, isn't it, to tell whether somebody's actually had the virus?
Exactly. What our group has suggested is that the app should act almost like an antibody test in your phone. So we've proposed a model that it's a statistical model that's able to properly handle the uncertainty of, have I been exposed? If I go out today, is it possible the places I'm going could expose me? It can deal with the biases in the data because obviously at the moment, all of the data we've got about the incidence rate and the death rate, it's all very heavily biased because we don't know most of the people in the death column of the ONS statistics. Well, they haven't even had an antibody test to find out whether or not they died of COVID. It's just assumed that they did. So the models that we propose are models whereby our app could tell you whether or not you might have been exposed, whether or not you should go out today, and whether or not whether or not you should consider going and getting tested. If we can give citizens proactive advice before they do something, that's better than trying to chase it up 14 days after they've already gotten sick.
All right, well, the wait, it seems, goes on. Dr. Scott McLaughlin, thank you very much indeed for your time tonight here on LBC News, joining us there to tell us more about the government's own tracing app, which effectively at the moment has been switched to the Apple-Google model. But as Dr. McLaughlin was telling us there, the government will have to come up with its own model. The question, though, is when. LBC